Good morning, everyone. It is 9:02 according to my phone, so let's get going with our MOTS EDI webinar, our monthly webinar. Welcome to everybody. Thank you for joining us. With me are my coworkers Jody, Justin, and Mary, and Lyle, I think, will be popping up. And we have a nice agenda for you. And for those of you new, or not that familiar with our monthly webinars, we do them every first Wednesday of the month from 9 to 10. And the 1 month we talk a little more about EDI, the electronic data interchange way of submitting data. And the other month we focus our attention a little more to the client entry, to the web data entry tool that we run for everybody who needs it. When you joined, a little panel popped up, and on that panel there is a box. And in that box, you can type any questions that you might have, because that is our main focus for today, to answer any of the questions that you might have, any issues you might have. And hopefully we can just type in the answer and give you the answer that you're looking for. And maybe if it's interesting for everybody, we bring it to the floor and we discuss it and explain what the question was and what the answer was that was given. The webinar is recorded, so don't worry if all of a sudden the phone rings and there's a fire to put out. You just take that call and you can always go back to our website. It's usually a day or two. It goes pretty quick. After the recording, we place it out there and we keep the last two always current out there. So currently you have the one from May and June out there, and then in a little bit you'll have June, July on there. So okay. That I think was what I wanted to talk about. So let's get going. As you can see, we have a nice full agenda, and we always start with the welcome and why do we do this? Well, one of the reasons we do this to give you information, because it's a live system that we work in a world where things do change, where legislative decisions are made, information requests and needs change, so the systems might change. And if anything of that happens, then we'll definitely let you know. And a big one, of course, is that there is a new MOTS coming in the future, but as soon as we have any details, we can use this forum to give you information about that. One of the other things we'd like to talk about is discuss data issues, and we have one on the agenda today to talk about unknowns. Justin's going to talk about that. We are open to feedback. We have the question box, and you can type in any feedback that you might have to maybe get ideas for certain future webinars, certain items that you within your organization, and maybe some other people in the field have run into certain issues that maybe it's an idea to talk about it and get more clarity on certain things in the business, that the way they are going. And of course, answer all the questions that you might have. So hopefully we can get to those, and I'll get back to the agenda to see. The next item is the user request form. We have a new one, and Mary is going to talk about it. Go ahead, Mary.
Okay, so we have in the past we've had like a Word document that we've sent out to providers to fill out and ask that they return to MOT support, but and then we take that information, we copy and paste the information that we need into a spreadsheet and into the actual request form that we have for requesting new users, and it's very time consuming. So we've come up with a new online form that is very user friendly, and you can use it to request a P number for a new user. You can let us know if somebody has left your organization and their P number needs to be inactivated, or perhaps the person's been there for quite a while, but they haven't logged into MOTS, and therefore their user ID is inactive. You can request that they be re-enabled. You can use this form that we've made up, and when you submit it, it automatically comes to us to MOTS support, so you don't have to remember to save the form and then attach it to email when you hit submit on this form, it automatically comes to Mott support, and it also pre-fills into a spreadsheet that we can use to check the information, assign it to somebody to process it in our unit, and it just saves us so much time and effort. Uh, and the neat thing about this form is when you submit it, it'll also send you an email to you and to the intended user with uh, that it's in, that we've received it. And uh, so you can request up to 3 new users on this form. You can or you can request that somebody be deactivated. You can request that somebody be re-enabled. And it's not only just for MOTS. You can if your agency does, for example, problem gambling or acute care, you can tell what systems that user needs. So it's very user friendly. Just if you have somebody that you want to add, or somebody just recently left, let us know. We'll send you a link to the form for you to fill out. So that's what I have to say about that, and I give the floor back to Pete.
Thank you, Mary. Looking pretty smooth. Excellent. Thank you. Okay, back to the agenda. On the next item, number 3 is a news update. It's a new thing we introduced a little while ago. And since we are expanding the Compass team that we all are part of, and our main focus was MOTS, but MOTS is kind of slowly fading. And there's new systems coming, and they will all be under the Compass umbrella. And I'm pretty sure that within the next few years, we'll have not the MOTS webinar, but we'll have the Compass webinar, and we can probably try to combine multiple things, unless there's brand new things that really need to focus, and then we can have separate ones. But some of the new systems, PGNet is problemgambling.net, has improved its EDI interface. And the EDI interface that you currently have for MOTS, compared to this new one, is very cumbersome. So the new one is pretty smooth, and you just click and drop, and the results are in a very neat and organized way. There were some problems when they started it, because it felt and looked a little clunky, but ever since they made the new improvements, it's really been a big success, and it looks really, really well, and it gives all the information that you can think of. It shows, I don't have a demo that I can do, but it really shows all the information that you now have to look for and work with our XML and back and forth in the results file and stuff like that. It has all the information, but with that, you can get it all online on that interface. It's just a click and a drop, and it works really good. So um, we might do a little show and tell on that. If we are in a certain phase with the new mods version, then we maybe show you, well, we currently have this for PGNet. Would this work for the new mod system, for example? Stuff like that. So, but when that happens, we'll definitely let you know. So, not yet, and it's just thoughts that we keep having, and ideas that we keep bouncing around. So, ACR 2.0 is launched, and it's working well. And we haven't heard any complaints, and everybody seems to be really working well with it. And it's all the data is in there, and everybody's pretty happy with it. Which ACR stands for Acute Care Reporting, which is the 10, 12 acute care facilities that we have in Oregon, and they all use that system. It is working very well. CLICS is the new license and certification system, and we made it stable. That was the first phase to make the system stable so that all current license and certificates can be printed and that we can do a proper inventory and get all the information. And that is good, and the people working with it in the different units are very satisfied on how everything's working. And our IT team is working on new screens and new parts of the system to expand and make it even better, and to work on completing the system as a whole. So all the new features, they're working hard on it, and seems to be doing very well. So the behavior health data warehouse, it is in progress, and we just last week finished sprint 1, and we accomplished quite a bit in sprint 1. We got a lot of data ingestion finalized and procedures set up. We did a lot of work on federal reporting that we are planning to come out of it. We didn't get everything we hoped to put in sprint 1, but that's kind of like a common fact that you kind of have to learn to deal with. And we're still expecting it to be completed by the end of this year. Might roll over in the new year, because we all know how it works. When the holidays come around the corner, then there's a lot less people and resources available. So, but it's still our goal, and we might get there. So. The MOTS replacement, as I mentioned already, is a plan, but there's no dates or schedule. We did recently get the okay to sign the contract with the contractor that's going to help us build the new system, but we haven't had any dates or any plans or anything yet. So that'll come, and as soon as we know a little more, we'll definitely let you know. So just keep submitting your data, and if there's any changes, we'll let you know. So as I also mentioned, provider plus EHR vendor can help us make that new system even better than what we currently have. So if there's changes, if there's data that nobody really uses, because those things happen. As I mentioned at the beginning, systems change, environments change, society changes. There's things that we think we really want now, and in 10 years, everybody's looking like, maybe we don't need it anymore. We want this now. So and your engagement, if we would like to see that once in a while, we'll definitely let you know as soon as we have room for that, and we are looking for volunteers, then we'll get to you. The administrative burden, the ones with no crisis submitting and no need for any updates. So unfortunately, we have not heard anything, which is kind of like sad, because I was hoping that they would come to say, okay, we're back in business and we're doing it this way. So basically, keep doing what you're doing. Send all the admission within 7 days, and all the discharges 30 days after the individual completed treatment or left treatment or stuff like that. So and it says there end of June. We were the previous news was that this rule would continue until the end of June, and it's been end of June and it's July, and we haven't heard anything. So, but I'll promise you, as soon as we hear anything, we'll definitely let you know. So that is the news update, and from there we go to Jody, and she's going to talk about accidental close.
All right, thanks, Pete. Great information on all of the news, all the stuff we have going on as a team with everybody. So, yeah, wanted to just talk about accidental close. I know it might be a familiar topic for some of you and brand new for many others. I know there's a lot of changes going around with organizations and people's roles and responsibilities. So we've been kind of recapping some of the ones that seem important. So what an accidental close is kind of self-explanatory. You accidentally close somebody in MOTS that you had reported to us as being active in treatment. So, like, we put an example up here to kind of help with this. So the question is, we have a client who is inactive with a discharge status of left against professional advice, entered an error, and we need to change that status and add the Dewey completion date. Sometimes the best way to handle these situations is to create a new treatment episode with an admission date that would be the day after the incorrectly closed admission date. You would complete the other necessary fields to create a new treatment episode and submit. And now that you have an active client, you can make the changes and you could change the status to the proper inactive status. So there's many times that accidental closes happen. It could be just somebody came in, they didn't return for treatment, and so somebody at the organization decides, well, we're going to close them, but then they return, or they get a hold of you within that period where you could reopen them, and your system has possibly already sent that no longer active to MOTS. So there's many times that things get accidentally closed, and we have heard the comments and feedbacks from others. So as we move forward into a possible replacement, upgrade, enhancement to MOTS with a more robust system, these type of things are things that we're taking into consideration for the workflow, so that some of the way we have to do things today, we are looking to improve upon that, streamline that. I don't know if this is the right point in the presentation, but we have heard many of you. We appreciate the feedback, and we've made lists of those. And so some of these things that have a little bit of a workaround, like an accidental close by reopening it with an admission date of the day after. In the future, hopefully we'll have a more efficient way of doing that. But for now, this is how we do it. And if you and for MOTS, again, I think Pete mentioned, just keep reporting in MOTS till you hear differently. We will be in touch, and we will be getting a lot of feedback and interaction from all of you. So thank you, Pete. Unless we have any questions, I'm going to turn it back to you for the moment.
Thank you, Jody. Let's take it back to the agenda, and we have the next item is Justin, who's going to talk about unknowns. Go ahead, Justin.
Before I do so, we do have a question from Jessica about the accidental close. Figure we should talk about that while we're still on topic.
Sure.
She mentions this is specific to the workflow of emergence, but the answered for accidental close may not work for them. They built a document group for several scenarios that requires a counselor to fill in a MOTS enrollment, review, and discharge, and they don't have a standalone document, or counselors would never remember to do them. Do we have any advice related to that? We may not, but figured I'd ask.
Ooh, that's quite a question.
Well, there's one. So this would be specific to the EHR system that Jessica has. If we have the option to delete a client in MOTS, the only thing is with the EDI submitters, if we delete a client, it deletes everything. So if this is a client who's been in and out of treatment multiple times, we may not want to do that. Delete it and then have you resubmit your system's forms that would be in the right order to kind of get that reestablished. But if it's a client that's new, you don't have a lot of history and data that you've put into MOTS on them, deleting that client is an option, and then resubmitting the initial MOTS for them with your system, and then modifying any of the data fields that you needed to would be an option. But I would recommend that if any of you are in that situation, get a hold of MOTS support and myself, and we can definitely try to guide you in what would be the best appropriate options at the time. But that's the only one thing I think I can think of right off the top that might be an option.
Thank you, Jody. I hope that answers Jessica's question a little bit. And if not, maybe, as Jody suggested, to take it offline and review what others might have run into. So.
All right, thanks for that. So what you see on your screen now is a calculation of unknown values in completed episodes. The 2019 column is from a previous webinar, and the 2020 column is more current data. We understand that sometimes you just simply don't have the information that MOTS is asking for, which is why some of those fields do have the option of selecting unknown. We're hoping, though, that during the course of treatment and interacting with the client, you would be able to find out that information. You know, maybe at the time of intake, they leave the "Are you a veteran?" box blank, and then you submit their admission data and you select unknown. But during treatment, the idea would be that you found out by then if they've had any military involvement, and you can indicate at discharge what their veteran status might be. So you can see several examples on your screen there. And these are, again, for closed or completed episodes. So you've been with the client for a while and now they're done. Source of income is looking pretty good. We used to have 25, almost 26% of clients unknown at the time of discharge, and now we're down to 13.5, so that's pretty good. Primary insurance has stayed about the same. Source of payment has gone down as well. Veteran status did go up for some reason, but this is partly just to encourage you to continue to communicate with your clients, and when something changes or you get the information that was previously unknown, please update your records and submit that update to MOTS so we can try to clear out as many of those unknown values as possible.
Excellent. Thank you, Justin. Yes, this is definitely a reminder in in our previous system, the CPMS system. For those of you who were around in those days, we had a rule that the system did not allow unknowns. So we are a little more lenient because we were asking some different questions. It was a different system, but it is one of the things that we consider to make sure that you do engage, and because it's so easy to forget something like that, but it's very important. We have requirements to report to legislature, to federal government, to management, so we would really like to be all our information in our system to be of a good value and quality data. So it's very important for for all of us that you try to get that information. And just yeah, unfortunately sometimes it takes the being a bit of a nag and push and keep being the squeaky wheel, but hopefully it helps and it works to improve the data. And as Justin mentioned, it is still going in the forward direction except one. So sounds good.
We did have one question, Pete, from one of the people here, wanting to know if they could get this unknown data by agency, and I think that is something that they could request through MOTS support and our team, correct?
Absolutely. I don't have that information at hand, but I could put it together pretty easily. So if you need a custom report including unknowns, just send an email to MOTS support or go to our website and fill in the report request form and we'll get you into the queue.
Excellent. Thank you, Justin.
Yes,
Yeah,
Justin is amazing.
That's an excellent idea. And that was one of the exercises we did in the past to review the unknown fields, because some, especially with EHRs, the question was not on the form, or it was not on the form, or it wasn't in the system yet. And the vendor promised to build it in the system because it's a federal requirement and it would come, but then they defaulted the file that was submitted, the status file, with an unknown because that was an accepted value. And maybe it has been implemented in the system, but maybe the default value in the file is not, that trigger has not been switched to actually grab the information that's in the system. So we did that to run certain reports if there were certain organizations that had certain fields always being unknown. So we should be able to get that to you. So, and that's very helpful, definitely. Okay, so we go back to non-Medicaid services. Yes, that is one thing that I did not mention when I talked about keep submitting your files. For those of you not that familiar with the whole EDI reporting, of course we have our status data, our basic demographics. When a client is submitted within 7 days, You submit that with all the client information and behavioral health, and if you do addiction, the drug matrix and all that information as well. So, and that whenever there's an update or whenever there's the completed treatment, we get that information. So, but also one of the things that was introduced with the new system, the new MOD system in 2013, was the non-Medicaid services. These services complement the package of services the individuals receive who are in treatment in Oregon. We all know the Medicaid claims. We all know that all the individual services that are provided by many providers that are at work in the state of Oregon, and all that information comes to Medicaid because it's a claim, and for that claim you get reimbursed. With MODS, it's a little different. We try to capture the information that an individual is not eligible for that particular service, or that particular service is not covered with Medicaid, or it is a person who is not Medicaid eligible, doesn't have a Medicaid ID. So that information, we put those in the non-Medicaid service files, and it's a separate file. It's the service file. And the way that works is, or we recommend you to work it, is in the middle of a month, review the previous month and see. You should by then have all the information of all the services that are submitted as claims, and maybe some that are denied. So maybe you can push it out a little bit later if you have a procedure that works that way. And then all the remaining services that are not covered, we'd like to see those in the MODS service file. And then we can hook them up with the clients as well. And in the behavioral health data warehouse, what we're currently working on, we get the full 360 view of individuals that are in treatment in Oregon. So the reason I put it back up here is because sometimes new grants come up, and they used to be Medicaid or Medicaid services, or other programs that we'd like to get information, and you want to set different services that haven't been covered by Medicaid. So um, as I mentioned, some individuals are Oregon Health Plan only, but some of the services the individuals are not eligible for, or they are not covered by the Medicaid system. So excuse me. So that's what I wanted to let you know. And yeah, even if it's a little bit later, it doesn't, we don't mind that much, as long as you kind of set up a process to review, set the stuff that was not accepted by Medicaid or not Medicaid eligible, or not really sure how to do that in your system, but I'm pretty sure your EHR has some ways to set things up. And then hopefully we can get those non-Medicaid services to complete the picture of the person in treatment. And I saw a couple of questions pop up, and I hope that somebody's reading them and will answer them, because I have another item and I will talk to that a little bit as well. One of the things that we did notice over the last few years during the pandemic is that many providers changed the way of doing business. And the way they conduct their business. And one of the things, what affected it was MODS, because certain people were doing certain things, but with going more into the world of telehealth and getting different ways of doing your business, then the way the MODS information was coming in was also a little different, and was new people were responsible for new things. They had new jobs and new responsibilities. Excuse me. What we would like you to do is review your organization and say, okay, everybody who is here now, is everybody still doing all the proper EDI functions? We used to do things in a certain way, but these things are added. These are new things. Are they still covered? And do we still capture all that information? Do we get all the information to the MODS, into the MODS system? One of the things that might change is, because of changing responsibilities, is the MODS contact person, the contact information, the email, the phone numbers. In our office, we lost our desk phones. So all those 945, 503, 945 numbers have disappeared, and everybody, I think almost everybody now has a a mobile phone, and that one should be in our contact. But your organization might have done the same. That landline disappeared, and everybody has a cell phone, but maybe there's still an old landline number in the MOTS information, in the contact information. We would like to know that, or a new email has been created for a slightly different name that your organization has. So um, if there are new individuals that you would like to see part of the EDI process and might be helping out, or might be a backup for an individual, and they could use a new P number, then you use the form that Mary showed you and request a new P number for them. That's for the MOTS web portal, so they can get access and do that information that I talked about, the contact information. For the SFTP, of course, you have to talk to Jody, because that's a different one with a different setup and a different password that we hand out. So also what we'd like to know is a little meet and greet. Who is new and who is doing what. So especially for Jody, it's very important and very helpful that she knows everybody a little bit, and she already knows a lot of people, but she loves to know more people and what they're doing and how they're doing things, because she learns from that and she can use that information if different organizations come and use a similar EHR or maybe the same EHR. Then she can kind of hint, say, hey, the people over in some other business, and she won't name names because privacy is very important, of course, but she can help you if you switch the system, to let you know what her experience is with that system or with other organizations with that particular system, and how they take care of issues that might occur within your system. So all these things very helpful. And that was all I had about the business changes. And I'm looking for there it is. And then I can read quickly the questions. Jody, switching systems.
Okay, thanks, Pete. For a lot of you, this is probably the same thing. One thing I would like to just add to what Pete was saying is I've really seen amongst the EHR providers that the ability to cross collaborate with one another. We just recently had an organization that notified us of a change in their staff, and we have been able to connect them with a similar organization from start to finish of their services, and the other organization has been gracious to help them, even setting up weekly work sessions. So, we have that ability here once I get to kind of know you and your organization and some of your needs. Again, I don't connect the dots of people if they don't want to be, but I've seen the collaboration over the years between providers is really amazing in this field. So I just want to put a shout out to everybody, because you all just really seem to pitch in and help each other. So switching systems, we know this is still continuing, even with the MOTS replacement possibility on the horizon. We still know that you are all, doing business and finding things that make your business function best for you. So if you're thinking of changing, you still need to report to MOTS. So if you're looking for new systems, we had somebody contact us and said, well, I heard that there might be a new system and that we don't need to worry about how MOTS works with our new system. And I was like, no, that's not exactly the right answer. So if you are, switching systems, MOTS functionality is still required if you want to submit through EDI. And we will be taking a lot of what we do currently today that works well as we move forward into a replacement, as well as more user functionality and just dashboards, great things that will make the web portal much more user-friendly and data accessible to your own data once we get that far. So we will, I know we're talking about switching systems, which I guess this is kind of switching systems. We're giving MOTS a facelift and some new enhancements. But just for everybody here too, as Pete mentioned, be on the lookout. We're going to be having some provider focus groups. I think we're going to do some of that based on EHR, because it makes a little bit of logical sense from my experience with all of you. So just be on the lookout for that. You see a message from myself or our team we definitely want your input. So switching systems, we'll run through this. For those of you that are new or haven't switched systems before, thinking of changing, let us know. If it's 12 months, 6 months, 1 month away, let us know. That way we can have you on our calendar. We can just know when to check back with you. Gets us involved in your process, and so we can help you along the way. If you're looking at EHR actual systems, and I mentioned the MOTS functionality, there's no one right way or wrong way for an EHR to collect the data. The only thing that's exactly impactful is how the data gets to us through our specifications. So each system has its own way of doing this process. And what we've seen other individuals do is they ask if they're looking at different systems, can you show me the actual process for doing this? How does it work from the time we see a client, maybe we pre-admit them or they're admitted, how does that work from that point to the actual system getting the submission to MOTS, or how does it get there? Because how much staff is going to be required and who will do which steps. Oftentimes there's this misnomer that EDI means no staff interfacing or spending time with it, and that's really, there's still some steps. You just have to kind of identify what they are and who's going to be doing them and managing that. Definitely does streamline things, though. No one way is better than another. There are just differences in workflows between the different systems. So, and when I say systems, I mean your electronic health records or medical record systems. So the other, things are project timing, which we'll talk about, so we know we can get our resources in line to meet your project's milestones and different success points. Also, we have a process for switching the data submission, and what that means is some of you on here might be client entry web portal submitters at the moment. If you're going from client entry to the electronic way of doing things, we have a process for that. If you're going from one EHR to another, we don't necessarily switch your data submission, but we have a process for that as well. If you're new to electronic data submissions, we're going to set up your secure file transfer protocol server setup. And basically that's kind of like a server or a post office where your files come into your box, so we can process them, and then we return you a results file in the other portion of your box. So that's really just a Dropbox location for your files. If you are going from either way, we want to talk about client IDs, because sometimes new systems will have system-generated client IDs or master client number. Some are called MRNs. But if you're going to be changing those, then we need to talk about that so that we can make sure your data aligns properly, and maybe we make those updates through MOTS support for you for the client IDs. We're going to test the files through EDI, and so you might be like, well, hey, I purchased system XYZ. They already have 10 providers using it. Why do I have to test? Well, due to customization with different setups and functionality, we're going to test the files out of the system at your provider's level of setup, because we want to make sure that everything's been mapped properly, that all the proper codes come through, and all of those type of things. So if your system is that you've selected or you're going to or upgrading to already submits, the testing process will probably be a little smoother in the sense of taking less to do, but we still are going to test you at the provider level. We are going to go live, obviously. That's the point we want to get to, relatively quickly. And then we're going to do some follow-ups. And the follow-ups are basically, once you're live, we can set up whatever intervals that works best for your organization, weekly, biweekly, monthly, whatever. But those are just to go over how things are flowing, what kind of error messages you might be getting, what kind of questions you might have, any type of troubleshooting or walkthrough of things we need to do. And we just do that as much or as little as needed. So, but the number 9 has been extremely helpful once folks have made that transition. So I want to thank you all for still attending, staying on here through this part of it, and because it is a little bit same from presentation to presentation, but we appreciate your involvement, attention, interaction. And with that, Pete, I'm going to hand it back to you, and I will look at questions here or anything that I need to. You can let me know if I need to do.
Thank you, Jody.
Oh,
Cool.
thank goodness.
Yeah,
I was like, I can't be muted, right?
no. We would have let you know. Don't. So we get to the questions and answers. A couple of things that I spotted, and there's some great questions and good ideas. One was from Jessica about the services that the codes that we currently accept are the HICPIC codes and not the revenue codes. And maybe that's something that we should think about in the future. Another thing is that I spotted is that if a counselor trained to report what is true today, so if they're doing a custody assessment and report the status as incarcerated, you can't start with an incarcerated, but you can start with active, and then the living arrangement could be incarcerated. I think that's the combination that we're looking for, because
or the legal status.
Or the legal status. You're right. Sorry. And there might be something in the living arrangement as well. So there's a different combination of those things, I think. The other thing that I wanted to pick up that I spotted is the amount, the gross household monthly income that you put in a 1 and then unknown. If you put in a 1, for us, that tells us that they refuse to answer that question. That's how we set up a 1, because nobody makes $1 a month. So the thing, if you roughly know what they're doing, and you can use the Oregon minimum wage, if they have about a certain number of hours or days a week that they work, you can come up with an estimated gross monthly household income. So there's flexibility in that, but please do not use 1 if you know some of the information, because 1 tells us that they refuse to answer. So that's one thing that I wanted to put in there. So, and any other questions I missed? I'm asking the rest of the team.
Not that I saw.
There's one more question that came in from Kimberly. And it says, if there is a crisis, I know we list it and then close it. It's a one-time thing. Am I understanding correctly that it needs to be reported within 7 days? And the answer is yes.
Yes, please. We always like to have everything in within, when they start a treatment, within 7 days, a crisis or involuntary service event also within 7 days. And sometimes if it's a couple of days late, you won't get a penalty, but because we don't stop doing it and say, because, oh, I'm too late, so I can't do it anymore. Please do. We'd rather have all your crises a couple of days late than none of your crisis information, because the more we know, the more we learn, and the more we can help the people that are in treatment in Oregon. So thank you. Okay. Well, I really enjoyed this session, and thank you all for attending. If you have any more questions and you're looking for something that you forgot and it pops up the other day, you can always send an email to motsupport@dhsoha.state.or.us. Something tells me that it's changing. I remember somewhere in the back of my mind that something changed.
Yes, the address is changed for Mott support. I think it's going to be at odsoha.state.or.us. When we send a reply to you, it should have our new address in there. So, or if we send something to you from Mod Support, it will have the new address in it.
Thank you, Mary.
Mm-hmm.
And I'm pretty sure we'll put that in our new in the next messenger, or maybe it's been in the messenger already. So, and I'll make sure that I'll correct it for the next webinar. As I mentioned at the beginning, a recording of this webinar will be posted on our MOTS website, and the MOTS website is the link at the bottom, the URL. On the website, we also show the future webinars, and it's pretty simple. It's every first Wednesday of the month, unless there's a special holiday or something going on that has happened in the past, but I think we're good for the rest of the year. So every first Wednesday from 9 to 10. The next one coming up focuses a little more on client entry. The data entry portal is on Wednesday, August the 3rd at 9 a.m. So again, thank you all for joining and have a wonderful rest of your day.
Thanks, Pete.
Thank you, Pete.